For weeks, health officials reassured the public about Ebola. They said the nation's healthcare system would contain the virus. With 2 nurses infected, that tone is changing. Mark Strassmann is outside the CDC in Atlanta. That's where the government now admits mistakes were made. Mark, good morning.
Good morning. The CDC has taken a lot of criticism, including from nurses in Dallas who say they didn't have the proper training or the proper protective equipment. Even the CDC has criticized its initial response, but says it is now taking steps to correct mistakes. When Thomas Eric Duncan was diagnosed with Ebola on September 30th, CDC Director Thomas Frieden was confident about containing the Ebola threat.
Virtually any hospital in this country that can do isolation for Ebola. We have no doubt that we will stop it in its tracks in Texas.
Duncan died October 8th. 2 of his nurses now have the virus, and more than 100 other people may have been exposed. The CDC is under fire for improperly preparing hospitals nationwide, including Texas Health Presbyterian in Dallas.
As far as I can tell, there wasn't training there. The CDC could have helped with that, but I think they didn't realize how large the gap was.
The agency now admits a mistake. Its rapid response team should have been mobilized to Dallas right away to help train the staff caring for Duncan, something the agency will do from now on. The CDC wants to better train U.S. clinicians to treat Ebola patients while protecting themselves.
How was that experience? You had a breach.
Like this group going to Africa.
What we are doing is giving people the practice here so that they can have appropriate confidence.
On Wednesday, a national nurses union complained proper protocols were lacking even at major hospitals like Dallas's Texas Health Presbyterian.
Hospital officials allowed nurses who interacted with Mr. Duncan to then continue taking care of other patients, even though they had not the proper equipment while providing care for Mr. Duncan.
Texas Health Presbyterian has refuted those charges. It says throughout Duncan's stay, the hospital followed CDC guidelines and its staff used the right protective gear. But Nora, no one can explain how 2 of those staff members became sick with the virus.
Important point. Mark, thank you so much.